Exercising, I can tell you, American Heart Association has said that if you are able to walk like 5 days a week, about 30 to 45 minutes, you can cut down the risk of like heart, which is one of the most common diseases, almost like 40%.
And I think it is important for human beings to understand that having a basic schedule of your daily activities is very, very important.
Common man can also understand when we are talking about stress and anxiety, because we live in a country where still people are confused about what is depression.
Welcome, esteemed guests, to an illuminating discussion on lifestyle modifications for disease prevention. Our distinguished panel of experts is poised to explore the crucial lifestyle modifications for preventing chronic diseases, strategies for encouraging patients to adopt healthy behaviors, and the pivotal role of patient education in fostering. Our panel features leaders in healthcare committed to promoting long-term health through lifestyle interventions. Dr. Bashir, cardiologist; Dr. Amna Alauddin, psychologist; Dr. Shehnaz Ibraheem, pediatric neurologist. To commence our discussion, let's address our first question. What lifestyle changes are most crucial for preventing chronic diseases?
See, the most important lifestyle changes obviously is the exercise. Okay, so wake up early, sleep early, the same things which has been taught for hundreds of years. Exercising, I can tell you, American Heart Association has said that if you are able to walk like 5 days a week, about 30 to 45 minutes, you can cut down the risk of like heart, which is one of the most common diseases, almost like 40%. No other medication does it. So definitely this kind of a simple thing you can do. And if you don't have time to exercise, you can just do routine walking. And I tell my patients a lot of times that you don't have to, I know we are a very busy lifestyle, so if you're not able to spare time, although that is the most important thing you can do or invest for your later life, is try to spare time for yourself for exercise. But the answer I get from most of my patients is that they don't have time to do that. So if you don't have a time, you can try to basically incorporate a lot of things in your daily activities which are going to really help you to improve your health. And what you can do, for example, during lunchtime, after the lunch, if you have time, you just go out, try to walk for a few 15-20 minutes, 10 minutes even, that's fine. In your office, don't use elevators, always try to use stairs. Climbing stairs is the best exercise. If you are traveling by a bus, try to get off the bus stop earlier or get on the bus stop later, so that you can walk to your office. Similarly, we park the car at a wrong place because just to be close to the place where you have to go. But the best thing is you can park your car a little bit far away and walk to that particular place. So even these little things you can adopt in your daily life, and that is going to even help you to get into these kind of activities. So I think exercise, walking, and whatever your hobbies are, playing anything. If you like golf, go play golf. If you want to play table tennis, go try to get time out of your busy lives for yourself. We are very busy at work, we don't have time, but it is unfortunate. We are very worried about financial investment for our later years, but we don't worry about our health. And that is the best investment you can do, is for your health, which is going to help you and your family. And you may not even require the financial investment, if you have invested in your health.
I could go on and on that. We have totally destroyed our lifestyles. We don't get up on time, we don't go to work on time, we don't sleep on time, we don't eat on time. So nothing is scheduled, and I think it is important for human beings to understand that having a basic schedule of your daily activities is very, very important. Family time is also very important, which is also being missed. Nowadays, most businesses do not start before 11, 12 o'clock in the afternoon. Parents don't come home, fathers don't come home late at night. Dinner is served at midnight. Sleep time is at 2 a.m. So unless we understand that the scheduling and proper use of daylight time is important, stress, anxiety, depression, pain, all of these will not go away.
I think we need to make help a little accessible. I do think so. We are very high-fived in terms of what charges we have. One, that I think accessibility is very important, as well as I think so we have to make sure that the language that we are providing them and the sort of advices we are giving them, they needs to be so lame and sometimes that a common man can also understand when we are talking about stress and anxiety, because we live in a country where still people are confused about what is depression and what is anxiety. So we have to calm down and lower our status and to be able to communicate what we are communicating to people.
Thank you for outlining those significant risks. Now, let's delve into our second question. How can healthcare professionals encourage patients to adopt and maintain healthy lifestyles?
I think the most important thing is you have to be role model yourselves. You see, when a patient comes to me and I tell them that you need to exercise, and they'll say, "Doc, I don't have time, I'm too busy." And I tell them that I'm busy too. I come here like 7 o'clock in the morning or 8 o'clock in the morning, and maybe reach home sometime even 10 o'clock at night. But I still, again, it really depends on what are your priorities in your life. You have to adjust the priorities according to yourself. So for me, the priority is that I want to invest in my health. And that's why I wake up at 5 o'clock in the morning. I go for cycling at 5:30 in the morning and come back like around 7:30, come back, and even after going home 2 to 3 times a week, I go to gym or exercise. So I think it's all up here. You have to really decide that what you want to do in life and what is the most important thing for you. So I tell my patients that if I can spare time, then you can do too. But if I am not doing it myself, how can I really tell my patients to do it? So when I tell them that I am able to spare time, I am able to do these things, the likelihood they will follow and they will do something is much higher. And I give same thing, I give them the example that you need to invest. If you see, we know that our life is limited, and but the worst thing which I will never like for myself or anyone else is the disability. If you get to your bed and you are not able to get out of it, you are not able to walk, you are not able to move, and you become dependent on others, that is the worst thing I can imagine for myself. And I think for that reason I try to invest or spend time in exercising and being active. So you have to really tell them all these things, and there will be good likelihood that they will adopt it. Like for example, I can give you one example. If I tell my patients that they smoke and I tell them to stop smoking, I was in US for 14 years, and when I used to talk to them, I said, "Doc, I've been smoking for like 60 years, 2 packs a day, there's no way I can stop it now." But the day they have a heart attack, next day they stop it without even thinking. So, but it's too late. So if you do something before something happens, it's much better. Because once you have a heart attack, once you have a stroke, once you have a kidney failure or something else, God forbid, then you stop taking care of yourself, it's too late. So you don't want to be dependent, you don't want to really become bedridden. So that's why you need to do something and invest in exercise right now.
I think counseling is very important. Every opportunity is an opportunity where you come in contact with parents and children is an opportunity for counseling, which is what physicians forget. We are very narrow-minded, we are very telescopic in our vision, and we do not, unless they are pediatricians. I'm sorry, I have this thing about being a pediatrician first. And for pediatricians, a healthy lifestyle is the first question we are going to ask. And so if you don't ask them, you will never know.
Go basic, go basic. Eat fresh and eat healthy. Sleep on time, sleep early. If we come back to our roots that we have left, I think so that's going to be amazing for all of us.
As we conclude our discussion, let us recognize the transformative power of lifestyle interventions in promoting long-term health and well-being. Through collaboration between healthcare professionals and patients, we can inspire positive change and pave the way for a healthier future.